And where we are now is in the sense that we are under-resourced from a human capital standpoint. It is extremely challenging to find qualified, experienced staff. And then we're also dealing with inflationary pressures of not only the salary pressures, but supplies, resources, and the partners. Partners' costs have gone up and partners' resources have gone down. In some of the facilities across the country, you're going to find that they've hit the tipping point that they just can't come back from. Whether it be staffing, whether it be specialist availability, supplies, lack of supplies. I think we're really on that edge of trying to figure out, are we as a healthcare system throughout this country going to be able to survive? So you have the increased financial pressures on staffing twofold. You have actually, let me say threefold. So you have contract labor, which we know nationally, those rates are 200 to 500% what they were pre-pandemic. You have the staff that are in your organization who see that and are questioning, why aren't you giving some of that to them? So you are raising salaries there. But then there's just the availability and what you have to do to have the availability of services. So if you are trying to offer 24/7 STEMI coverage, or if you're trying to offer 24/7 orthopedic coverage or intensivist coverage, there are real costs there. And if we don't address that sooner versus later, we may, as an organization, both locally and on a macro sense, have to cut back on these services. So we know in medicine, time is muscle, time is brain tissue, time is XYZ, right? And so for us, we are having to make decisions on a daily basis. Do we cut our STEMI coverage? Do we cut our stroke support? These are tough decisions that are being made on a daily basis. And at some point, we'll have to make them long term. Hopefully that decision is one where we can keep the service. But the reality is we just don't have the staff or the resources to make these long-term decisions today. Well, I think short-term, we're going to have to do some type of bolus to the facilities throughout the country. I know we got one in 2020, and that was critical for then, and it's critical today also. So I think the first thing is that we've got to give an infusion of cash to help the organizations. I think we've talked about some other things like workforce development and making sure that we have workforce of the future, and making sure that this is something that we as an industry is seen as a viable space for those who are coming out of school or looking to change careers. And then lastly, we are going to have to address the reimbursement, that whole process. We have managed care who are making it more challenging to do the things we need to do to take care of patients. We have the reimbursements in some areas that are below cost. And so we're going to have to fix that long term.